Good afternoon, ladies and gentlemen. I'm Dr. Rajesh Pandey. I work at the BLK Max Super Specialty Hospital, New Delhi, as Senior Director and Head in Critical Care. Well, friends, I've been asked to talk on a very sensitive issue, which is challenges confronted by doctors and healthcare workers while seeing the patient, and the role of NABH accreditation in combating these challenges. When I was given this topic, I thought, let me talk to my colleagues in the department and ask them what are the issues. So some of the issues that came to the fore was that we are not being appreciated for the good work that we do. The female workers found the work-life balance was becoming more difficult. There was increased job-related stress, and the media and all around were painting a distorted image of the profession. And people were concerned about big and bigger chains appearing in healthcare, with the problem of hospital cartelization. And of course, violence and disruption of services it affects everybody's morale. Further, when I asked them, all of them wanted a pleasant experience for their patient in the hospital. And they said that infrastructure should be good so that high-end care should be provided. And they were concerned about safety of their patients, and they were also concerned about the infection control measures, staff competency, because the average lifespan of a nurse now is 1 to 2 years in corporate sector. Most of them migrate to UK, Gulf, or elsewhere for better salaries and better work-life balance. And people were concerned that family counseling session takes a lot of their time. And, there was little clarity on end-of-life care. Plus, they were concerned that every hospital should have a palliative care component. Otherwise, all these patients are being dumped in the ICU. And of course, they are concerned about, long hours they spent in documentation. And one of the major fears is litigation and medico-legal problems. So these were some of the things where I feel NABH has been helping us and offers guidelines and tremendous help. For example, let me start with most physicians felt that, and the nurses felt that patients should have a pleasant experience. Now, what does my patient want? He wants a good environment. He wants a smooth admission process. He wants a comprehensive multidisciplinary care. And how does NABH help me? Well, you look at their access assessment continuity of care. It ensures diagnostic and therapeutic facility run by qualified staff is available in the hospital. Services are on display prominently for my patients and their families. SOPs are there for registration and admission. There is no confusion. Patient has a unique MRD and IP ID when he's getting admitted. There's bar-coded ID bands for all activities in the hospital, ensuring safety. And the hospital, because of NABH mandate, directs me to another facility if bed or service is not available. And for my patient, case summaries and treatment details are available. And my patients are informed about their rights and responsibilities. Patients and families are educated about the medical problems and the do's and don'ts, because that is mandatory from NABH. And there are effective complaint and redressal mechanisms which are transparent and effective. So NABH emphasizes on initial assessment across the hospital along with the TATs. Nursing and physician assessments are separate, and we need to write a working diagnosis and plan of management in the case file. All orders have to be authenticated, signed, dated, timed, so on and so forth. Regular assessment has to be done, and there has to be a rapid response call system in the hospital, as well as a code blue protocol in place, so that those who are in an emergency situation, admitted patients, can be immediately attended to. Sorry. Excellent lab imaging infrastructure should be there, where safety, accreditation, quality control, turnaround time, and critical alerts are the routine. This is what NABH asks us to do, increasing the safety for my patients. All these processes are mapped, they are documented, and their effectiveness is being measured. Some of the things that are implemented is stroke protocol, trauma protocol, acute coronary syndrome protocols, and many more protocols and codes are in place so that the time taken for initiating treatment is minimized and the care is maximized. Error prevention protocols are in place. NABH emphasizes that care should be continuous and multidisciplinary. Discharge has to be a pleasant experience, and NABH emphasizes on planned discharges, and my patient should know when he would leave the hospital. Detailed structured discharge summary with all instructions regarding medication, regarding any physiotherapy, regarding nutrition, so on and so forth, when to visit next. So all this is given there, along with the how I was treated in the hospital, all that is given. And of course, NABH ensures that a good infrastructure is provided so that high-end care can be given to my patient. Excellent building, all the norms are specified. So NABH includes engineering needs and fire safety as well. And the hospital should have all facility like cath lab, OT, dialysis, ER, ICU, OP and IP, depending on what kind of hospital it is, how many bedded. Even there are guidelines and protocols by NABH for safe transport in ambulance. Nursing protocols are very well laid out. All care has to be documented. Clinical procedures are being made safe because of, they have to be structured, well documented, and done after taking informed consent and using timeout and other, safety precautions, following these safety precautions. Transfusion protocols are in place. Monitoring is done for patients who are being transfused, and any reaction is noted and analyzed. So this tremendous thing that the hospitals are doing because of NABH guidance. The infrastructure guidance for ICU and OR are very exhaustive because these are specialized areas. So they have to follow NABH norms. If the hospital is going for NABH standards or is NABH accredited, adequate equipment and staff is also emphasized. Safety and infection protocols are followed, they are documented, they are updated. So overall, it is creating an effective and safe environment for the care of my patients. There are pediatric obstetric safety protocols in place. Infection control measures, preventive measures are in place. Procedural sedation is a privileged task. Anybody cannot do it. The process of privileging is there, which changes as the experience of the worker grows. Safe anesthesia services, including all dimensions, pre-anesthetic, intraoperative, postoperative care, adverse event monitoring and reporting. There is emphasis on pain management, rehabilitative and nutrition services. There is lots and lots of emphasis on informed consent. So if anybody is doing anything in an NABH accredited hospital without taking an informed consent, it is considered a sort of criminal activity. And there is no excuse for this. High-risk cases are identified, a high-risk consent is taken there. Medication management is excellent. So including double checks, including, a lot of things. I'll talk about that in detail. Now, end-of-life care, there are written guidelines in place. NABH emphasizes that hospitals should respect the values, religion, and cultural preferences of patients. Patients and family both should be involved in care. And NABH suggests that we should have open discussion on all aspects of palliative care. And there is emphasis that symptom control processes, including pain control, are in place in the hospital. And wherever there are legal issues, law of the land is to be followed. Medication management, because NABH emphasizes there is a formulary in every hospital, NABH accredited hospital. It is ensured that pharmacy environment is clean, safe, and secure. Pharmacy procurement, inventory management, dispensing, recall process are well defined, monitored, documented. Narcotic policy of Government of India is followed and documented. High-risk medications are identified, stored with controlled access. Reconciliation of medication is done the moment patient arrives in the ER, plus whenever his location changes. Prescription guidelines are followed, drug allergies are documented, drugs are safely administered, documented, adverse drug reactions are documented, reported, analyzed. So what all this does, it increases the safety. Nothing can go wrong. The attempt is being made to make the healthcare completely safe. And of course, the infection control. We are a tropical country, so the rate of infections are higher compared to the cold countries or European and Western countries. There has to be a functional hospital infection control committee. Infection data must be captured and be easily accessible. It is shared with me. I know everything about my hospital. Infection prevention measures are in place. They are monitored, they are documented. Hand hygiene is practiced, monitored, documented. Infection control infrastructure is there. Infection control nurses are there as per the bed recommendation given by NABH. A multidisciplinary team is there for supervision of the performance of these, infection control practices. Contact and airborne precautions are in place. Isolation rooms are available. Antimicrobial policy is made. It's well documented. It's updated regularly. Antimicrobial stewardship program is functional. It is efficient. And the biomedical waste, NABH ensures that the standard Government of India guidelines are followed for collection and disposal, or the local body guidelines are followed. Kitchen sanitation, food handling is monitored, documented, it follows standards. Health checkups, vaccinations are done for new joinees. Post-exposure prophylaxis is available and provided to staff. So who ensures all this? Patient safety, staff safety. This is happening because we are following the NABH guidelines, which are being updated as more and more information becomes available. Again, emphasizing on safety, quality control, quality assurance programs are in place. They're effective. The NABH asks us to have key indicators for clinical as well as non-clinical services. We need to monitor them. We need to see their effectiveness. All quality data is analyzed for further improving the processes and protocols. Culture of safety is emphasized to be present in the hospitals. Incident collection, ADR reporting is encouraged, analyzed for further improvement. Management is proactive and is providing all support to the staff because they understand that if they have to be NABH compliant, then they have to follow all this. Escalation matrix is clearly defined and displayed internally. Vision, mission, values are highlighted, they are followed. Management is professional. They plan, they budget, they have various committees as per the requirement, suggestion and requirement of the NABH. These are functional. They have their regular meetings. The minutes of the meeting are recorded. Actions are taken. So all this is there. And HR does due diligence. Even there are guidelines for HR. Recruitment of staff, they have to see the medical license, the DMC registration, they have to see the nursing license, and all those necessary claims that the physician or the nurse is claiming. And staff knows its rights and responsibilities. So there's a process of privileging, like I said, privileging at every level, and it changes year to year. All kinds of redressal mechanism, disciplinary grievance, etc. are there available. They are known to staff. Staff induction program is functional. Mock drills are organized regularly for all codes. Staff appraisal is done regularly. Staff health checkup is done. Staff privileging is done. Staff accreditation verification is done. Leave policies are transparent and law of the land is followed. Documentation, one of the major bugbears, because we do not want to document. We just want to do things, say things, but not document. That's a problem, because what can be discussed in case of a dispute is what is documented only. So documentation, NABH ensures that we do an initial assessment. We write about medication reconciliation. We take informed consent before anything and everything that we do. We write procedure notes. We have case notes, which includes critical lab and radiology alerts. And we put counseling notes, whatever we explain to the families or the patients. And death notes are exhaustive, complete, as well as the discharge summaries, because these all documents highlight about the care given to the patient. So in a nutshell, the medical legal problems arise because the customer or the patient is unhappy. And when he claims that he was unhappy, or the services were substandard, or wrong things were done to him, or inappropriate things were done, what helps us is the documentation. So and a culture of safety, safe environment. So this is where, if I'm a NABH approved, accredited hospital, I can tell the patients and their families, proudly that, look, we have all these standards in place and everything is being monitored. So we will ensure that nothing goes wrong. And if there are smaller issues, they are escalated, they are analyzed, and action is taken immediately. So NABH, I think, is helping the healthcare professionals a lot in all these domains, because NABH keeps on updating its guidelines, and as a result, the standards keep on becoming better and better. So I think we as physicians are grateful for NABH, to NABH, for providing all these guidelines and helping us out. Thank you very much. Thank you.